I think we're starting. Okay, how are you guys doing? So I wanted to go live today and talk a little bit about play therapy. So let me see if anybody hops on. And if you do hop on, um, feel free to ask me a question when you're on here. And if not, that's cool. I'm going to explain it anyway. So basically, if you don't know me, my name is Anastasia Avruz, and I am a registered play therapist. I'm also a licensed mental health counselor. So I'm going to tell you kind of about my background a little bit, just so you kind of understand where I'm coming from. So I was a teacher for years, and then I was a school counselor. I was a teacher for 5 years. I was a school counselor for 9, and then recently I opened a private practice. And in the midst of like the school counseling and coming to my private practice, I worked on a certification called a registered play therapist. And so with that certification, I learned how to do play therapy. So when you're looking for therapy for your child, I always tell people make sure you find someone that's a registered play therapist. That is very, very important because they're the people that are trained in how to do play therapy effectively, and they know what it is and how it works. And if you don't have someone that has the hours or the training or the supervision, you're not necessarily going to get someone that knows what they're doing with play therapy. So it's not just playing. I'm not, and if you're a person that works with me and I work with your family, you know that. But general public, I don't think always does know. And so a play therapist isn't in there just playing with your child. There are a lot of techniques and things that we do to help them get through whatever they're getting through, right? So the first thing I want to say about it is basically just make sure that you find someone that is certified, that has that registered part, the registered play therapist, and that they've accomplished all the hours and the supervision that go along with becoming it. And then you also, another thing with the play therapist, having that license or certification, you have to do continuing ed. So every year I do more continuing ed to make sure that I'm staying up with the research and I'm staying up with my training and connecting with other people in the field. So I'm not all alone out there just doing what I think should be play therapy. So this week is National Play Therapy Week, and I wanted to make sure that, hold on, let me just close something really quick. Okay. All right. So I wanted to make sure that I really explained it because it is such a passionate thing for me, and I really want to make sure kids are being helped in the appropriate way. So let me tell you a little bit about what play therapy is. So play therapy is basically a child being able to have a therapeutic session without having to be asked a ton of questions and to talk about it, right? So it's not just playing. It is them being able to play and not feeling like they have to use words, right? Because children don't always have the vocabulary. So if you think about yourself, you could be 25, 35, 45. We've had all those years to learn a lot of language. And when kids are little, they don't necessarily have that language to explain how they're feeling. And I'm sure you've been in situations with your child and you've asked, what's wrong? Why are you acting like that? And they just look at you because they have no idea. And they probably don't, right? Like they can't say it, they can't explain it. And so if you have a child that regularly has struggles and things happening that are not what you think is developmentally correct, you might take them to a play therapist because then we can work through it without me going, what's wrong? Why are you acting like that? And a lot of the times we'll do it through the play, and they'll be able to play with me using the techniques that a play therapist uses to kind of get all of that stuff straightened out inside. So it will help enrich the counseling experience for them when they have someone that knows what they're doing with the play therapy. And if you just hopped on, make sure you go back and listen to the beginning because I explained how we got to what a play therapist is and how they do the therapy. So yeah, that's the basic part about it. And the other thing is that you have to make sure that whenever you're working with someone that they've had that training. That's like the biggest thing I kind of explained at the beginning was just making sure you find someone that has that training. So the play therapy process, it's a way for a child to do therapy without having to use words and being able to play. Play therapy can be used to help with anxiety, grief and loss, academics, self-concept, social skills, all of those things, because there's no pressure on them being able to explain something to you. It's all done through play. And because kids do not have the vocabulary, they're able to play instead of being questioned and asked and forced to talk about whatever it is that's bothering them. So that's kind of the basic parts about what play therapy is. Another thing, if you're a family that doesn't really process stuff with feelings or words, that's going to make it even harder for the child, right? So if you're a family that doesn't talk about how you're feeling a lot or doesn't use a lot of feeling words, that's another thing that makes it a little bit more difficult for them. So we do a lot of that in the office, and that necessarily isn't play therapy, but it does teach them more language to help when they're at home and they're struggling. You can talk to them about things once they're able to say, I am angry because of this. And you'd be surprised, a lot of kids can't do that because they don't even understand why they're angry. So a lot of times when people are working with me, we work on feeling words, and I'll give parents homework to go home and really practice that at home. Start bringing feeling words into conversations, start bringing them into books and just talking about it more. And then kids can explain better how they're feeling. But the overall play part, a lot of it just has to do with being trained and working with kids in a way that doesn't make them feel like they need to be explaining something. All right, so I wanted to see if anyone had any questions as we are here. And if not, that's totally fine. Okay, so yeah, I don't know. I guess that's really all I had to share about what play therapy is. What we're going to do the rest of the week is basically I will give a couple different tricks of things you can do at home. Oh, here's somebody. Hey, Holly. I hope it works. Is that helpful, what I talked about? Was that making any sense to you? I hope it does. But yeah, so the rest of the week, what we're going to do is I'm going to show you a couple things you can do at home that would be effective in helping your child. So yeah, if you are looking for therapy for your child, my main piece of advice is find someone that is a registered play therapist. And I will put the link below of how you can find someone that does that in your area. And if you have any questions, just let me know. You can always send me a message or comment below. Great, Holly. I'm glad it helps. Sometimes I feel like I'm talking and I don't really know if I'm explaining it correctly. But yeah, just let me know if you guys need anything, and I hope you guys have a great day. Bye.